This is an assessment task for well-being and prevention in health subject, answering the question, why do Aboriginal and Torres Strait Islander children and youth in Australia still experience significant inequalities in health? This is Arquin L. Chong. What is health inequality? The World Health Organization defines health inequalities as differences in health status or in the distribution of health determinants between different population groups. Australia is ranked as the 11th richest country in the world, according to Forbes in 2017. It is very diverse with multinational migrants from other countries all over the world. Australia has one of the best healthcare systems in the world, and Australians, both indigenous and non-indigenous, are being looked after by the government through their health programs and policies specific to Australian needs. These are the Australian people, the non-indigenous, and the indigenous. In spite of being rich, there is a group of indigenous, which is just a minor population, which are the Aboriginal and Torres Strait Islander people. Aboriginal and Torres Strait Islander people are scattered nationwide in Australia. They have their special culture, language, and histories. But in spite of having good healthcare system and being rich, there is still inequalities in health in the different population. Some long-term challenges are still present. Even the health and well-being of Aboriginal and Torres Strait Islander people have improved in recent years. The Australian Institute of Health and Welfare in 2014 reported that the Indigenous Australians have poorer health than other Australians. But how do we measure this? We have to understand the social determinants of health to understand why there is inequality in health in different populations in the country. Health status of Aboriginal and Torres Strait Islander people are determined by life expectation, death age and rate, infant and child health, chronic diseases, communicable diseases, oral health, mental health, and disability present in the population. Just to compare the health statuses of Indigenous and non-Indigenous Australians in a certain period, let's look at the life expectancy at birth by sex and Indigenous status in comparing 2005 to 2007 and 2010 to 2012. By just looking at the legends, the colors, it is obvious that the non-Indigenous population has higher life expectancy than the Indigenous population over the years. In the last 50 years, Australian government have tried a lot of strategies to improve or decrease the gap in health statuses of the two populations. There are a lot of existing policy approaches for improving the health status of Aboriginal and Torres Strait Islander people. Over recent years, governments have made these commitments to address the health inequality a major priority. Let's look at one major program that the government has established in 1989. This was a landmark document providing agreed direction for Aboriginal and Torres Strait Islander health policy in Australia, the National Aboriginal Health Strategy. They are focusing on building community control of Aboriginal health services, increasing Indigenous participation in the health workforce, reforming health system, health promotion and prevention, improvement of the effectiveness and adequacy of essential services, and building effective intersectoral collaboration. But in July 2003, they had to revise this because the National Aboriginal and Torres Strait Islander Health Council stated that this health strategy was never fully implemented, but remains the key document in Aboriginal and Torres Strait Islander health. It is extensively used by health services and service providers and continues to guide policymakers and planners up to now. By revising that framework in 2003, this is also called the strategic framework, which just improved or revised the old one, and they are focusing on community-controlled primary healthcare services, health system delivery framework, a component health workforce, emotional and social well-being, environmental health, wider strategies that impact on health, data, research and evidence, resources and finance, and accountability. This framework commits governments to monitoring and implementation within their own jurisdictions, working together at the national level and working across government on joint initiatives between health departments and other portfolios. The third program is also an additional approach to the latter one. In 2004 to 2009, they implemented this, a national strategic framework for Aboriginal and Torres Strait Islander peoples' mental health and social and emotional well-being. They now focus on children, young people, families, and communities, strengthen Aboriginal community-controlled health services, improved access and responsiveness of mental health care, coordination of resources, programs, initiatives, and planning, improve quality data and research. But why do Aboriginal and Torres Strait Islander populations still experience significant health inequalities in Australia, even if there are strategies that are implemented by the government for years and years? The Smith family in 2017 noted that by almost all socio-economic indicators, Australia's Aboriginal and Torres Strait Islander peoples are the most disadvantaged group in the country. The inequality persists between the two different populations, particularly in relation to chronic and communicable diseases, infant health, mental health, and life expectation. A lot of factors may contribute to the gap between different populations in Australia. Social disadvantage, such as lower education and employment rates. Others are higher smoking rates, poor nutrition, physical inactivity, and poor access to health services. This is particularly in relation also to mental health as well as oral dental health problems, and these issues do not receive adequate attention in health frameworks and needs to be readdressed. So what is the current status of Indigenous health in Australia? The Indigenous people do not have equal opportunity to be as healthy as non-Indigenous people. There is a socio-economic disadvantage experienced by the Indigenous population that put them at risk of exposure to behavioral and environmental health risk factors. We will talk about this on the next slide. They don't have equal access to primary health care and health infrastructure, including safe drinking water, effective sewerage systems, rubbish collection services, and healthy housing. Probably because they choose to live remotely. And from what I've learned today in Koori Heritage, they were pushed aside to the remote areas or regional areas because they have fear of living where the new and modern population have settled, which is in the city. The Aboriginal and Torres Strait Islander peoples have not had the same opportunity to be as healthy as non-Indigenous people. This occurs through the inaccessibility of mainstream services and lower access to health services, including primary health care and an inadequate provision of health infrastructure in some Aboriginal and Torres Strait Islander communities. Behavioral and environmental risk factors that are still present in our Indigenous people that makes them vulnerable to poor health outcome. Smoking, risky alcohol consumption, illicit substance use, overweight and obesity, poor nutrition, physical inactivity. So, the Indigenous Australians were more likely to assess their health as good or excellent if they had higher incomes and education levels and owned their home. The government is working on the housing remotely, spreading the population to the regional area, granting benefits, incentives to people who want to live remotely and to mingle with these Aboriginals. Scholarships for education of Aboriginals are being implemented by the government. And for income and employment, they're giving chances for all the Indigenous people to work in any establishments in Australia. And these are 3 good programs of the governments as well. In conclusion, strong and well-planned programs should be taken now because the health status of the Aboriginal and Torres Strait Islander people, especially the children or the young ones, could worsen. But we need time and more money to be able to do this. The government should be looking on 20 to 25 years of programs to be implemented firmly to be able to see significant, real, and sustainable change. Indigenous Australians have lower life expectancies, higher rates of chronic and preventable illnesses, poorer self-reported health, and a higher likelihood of being hospitalized than non-Indigenous Australians. And Indigenous people choose to live in the remote areas where they feel comfortable and don't have to mingle with the modern non-Indigenous people. Therefore, differences in health with increasing remoteness could also be explained by the poorer health of the indigenous population living in these areas. Thank you for listening to my report.